Welcome to the GoalZero Toolbox Talk series. Today's Toolbox Talk: back protection. Some of the most prevalent and hardest to prevent injuries on the job are back injuries. They also account for 1 of every 5 workplace injuries or illnesses. The way our spine works is also attributed to the high number of workplace injuries each year. The complex structure makes it possible to cause an injury and subsequent pain from even simple movements. Most people know that turning from side to side while lifting heavy items is never a good idea and can cause injury. Most do not understand that any action that puts a strain or burden of added weight on your back can result in injury. Different types of back injuries can cause different levels of pain. Some can be temporary, acute, and some can be permanent, chronic. Acute back pain lasts between 3 to 6 weeks before it goes away. It may occur immediately after the injury and be quite severe, but it is temporary. Some types of acute pain are muscle spasms, strains, or muscle tears. Acute back pain tends to resolve on its own with self-care and there is no loss of function. Chronic back pain lasts longer than 6 weeks and may be permanent. For some, it lasts for months, years, or even the rest of their lives. Some types of chronic back pain are herniated discs, sciatica, and osteoarthritis. Chronic back pain normally requires intervention from a doctor for pain management and treatment. It is not uncommon for workers to experience a back injury in the workplace. Lifting, pushing, twisting, and pulling can all cause back injuries. If you overuse or overstretch your muscles, you can also cause strains. When on the job, there are several ways you can protect yourself from back injuries. Too often we forget that backaches rarely occur on their own. Repetitive handling can also cause other types of injuries. Many times, back pain is accompanied by lacerations, crush injuries and fractures caused by uneven surfaces, falling objects, a fall by the operator and impacts. Musculoskeletal stress is also harmful to other joints and muscles in the human body, mainly at the neck, shoulders, elbows, knees, hips and fingers. Fatigue can also be a factor leading to increased heart rate and blood pressure and sometimes respiratory problems. The best option to prevent back injuries due to lifting is to eliminate doing any manual lifting if possible. To achieve this, you should do proper planning of the work, proper setup of the work area, and use proper pieces of equipment such as a forklift to complete the lift. To prevent back injuries due to lifting is to eliminate doing any manual lifting if possible. To achieve this, you should do proper planning of the work, proper setup of the work area, and use proper pieces of equipment such as a forklift to complete the lift. You can reduce the risk of back pain if you stay in shape through regular physical and aerobic exercise, increase your muscle strength, especially the abdominal muscles, and adopt proper lifting techniques. But make no mistake, it is primarily by reconfiguring your workstation, lightening loads, slowing down the work pace and using handling equipment that you will most likely reduce the risk of back pain.